pharynx, because the prevertebral fascia covers those muscles which are in front of the vertebral column. What are these muscles? The longus colli, longus capitis muscles, and this space is called retropharyngeal space. It's an important connective tissue space. It continues after the pharynx behind the esophagus, because the pharynx here continues as esophagus, and this space continues here behind the esophagus. In this region it is called retrovisceral space, and at the end we go into the thoracic cavity, and here it continues into the posterior mediastinum. And why are these connective tissue spaces important? Because the inflammations, cancers, or can spread relatively quickly through the connective tissue spaces, because here can be found also the lymph nodes. Okay? No, and then, if you look at the tongue, and look at the oral cavity. Here, this was the vestibule. We have not teeth there, therefore we cannot see well the dental arches, but this is the vestibule. And inside here we have the oral cavity proper. And you can see the some muscle of the tongue. What is this? From the mandible to the tongue, it's clearly seen. Genioglossus. Genioglossus. Then here you can see, this is the hyoid bone here, okay? This one. And this muscle passes from the mandible to the hyoid bone. How do you call it? Geniohyoid, okay? Genioglossus and geniohyoid all comes from the mental spines, okay? And under the geniohyoid, the last muscle here, this is the mylohyoid, okay? This is the floor of the mouth. So genioglossus, geniohyoid, and mylohyoid can be seen in the mid-sagittal section. Okay? Here you can see the dorsum of the tongue, and this one is the root of the tongue. Here you can see very well the difference between the dorsum and root. This one is the border, the terminal sulcus. Just in front of the terminal sulcus, you can see these big elevations. These are the circumvallate papillas. On the sides of the tongue, these structures, these are the foliate papillas. And here, these bigger are the fungiforms, and the smallest are the filiforms. Okay? And here in the root, you can see, well, these elevation caused by the lingual tonsil. Okay, here, these are the follicles of the lingual tonsil. Behind the tongue, you can see the epiglottis. The epiglottis is on the entrance of the larynx, at the entrance of the larynx, because it closes the entrance of the larynx during the swallowing. Okay, and the epiglottis is connected with the tongue by folds. Here you can see a fold in the midline. This is the median glossoepiglottic fold. And laterally we can see two other folds. These are the lateral glossoepiglottic folds, and between them these depressions are called the epiglottic vallecula. Okay? And then behind the epiglottis, this space is the larynx. And behind the larynx, this structure, what is cutted now in the midline, but if I unite it, this muscular wall belongs to the pharynx, okay? It is the laryngopharynx, just behind the larynx, okay? If I open it, the cavity of the larynx is then here, okay? Behind the cavity of the pharynx is behind the larynx, okay? And if I open, these muscles are the constrictor muscles, and if I cut them, then you can see that both sides of the epiglottis, there's a dilated portion of the pharynx. This dilated portion is called piriform recess. During the swallowing, the fluid and food passes on the sides of the epiglottis through the piriform recesses, okay? And then it continues to the esophagus. How many parts of the esophagus can you distinguish? We have heard about it just now in the histology. Three. The first is the cervical part. Second one is inside the thoracic cavity, is the thoracic part. And at the end, we have the abdominal part in the cardia. The esophagus first starts at the level, which cartilage? Cricoid, at the inferior edge of the cricoid cartilage, okay? And then first it is a little bit on the left side, then it turns to the right side because of the aorta, because the aorta comes here in front of the esophagus, so, and it presses the aortic arch, no, not, it's not good, yes, the aortic arch presses it to a little bit right, and then it can be found on the right side of the aorta, but when it passes through the diaphragm, it crosses the aorta and passes to the left side, and that's the position between the aorta and esophagus when they pass through the diaphragm, because the esophageal hiatus is in front and a little bit left to the aortic hiatus, okay? So from the left it passes to the right, and then anteriorly and then left, okay, to the aorta.
It's posterior.
At first it is behind the aorta, but it starts a little bit on the left side. Then when comes the aorta, it is behind the aorta and it passes to the right side and can be found on the right side of the aorta. But here we are at the level of the diaphragm. Here the esophagus crosses the aorta and it passes through the diaphragm in front of the aorta. Okay? No. So we'll study all these things, and then now if we turn this preparate on the other side, you will see here also muscles. No. How can you imagine? This is anterior view, okay? The tongue is in this direction, and then this is the anterior view of the neck, okay? You can imagine. No. Then here is the hyoid bone. We cannot see it well, but you can palpate it, you can feel it, because it is surrounded by muscle. Because from here originate superiorly the suprahyoids, the infrahyoids. First, after the hyoid bone, we have the thyroid cartilage, and after the thyroid cartilage, this cartilage is the cricoid cartilage, okay? And then these are the thyroid glands, and this one is the trachea, this one is the esophagus. Here we are in the neck and in front of the esophagus. Here we have the trachea, okay? And the trachea divides into principal bronchi, and here disappears, okay? And here continues the esophagus.
This is the top also.
Trachea
Right and
also.
left.
Trachea. After the cricoid, here you can see well the thyroid, cricoid, and the tracheal cartilages, okay? And this part belongs to the larynx. Continuation of the larynx is the trachea. Yes?
This is the thyroid
These
gland.
are the thyroid glands, both sides, okay? And then what are these muscles which hang here? Because we remove this preparate from the body, and therefore, what are, as you remember, what are the infrahyoids?
Thyroid, sternoid.
At first we have both sides of the midline, the sternum. Here was somewhere the sternohyoid. If I remove them, under them, you can see two muscles, one between the sternum and thyroid cartilage. This is the sternothyroid, and the next is between the thyroid and hyoid bone, the thyrohyoid. Okay, and the remaining one, this one is the omohyoid. So these are the infrahyoids, and how can we see the suprahyoids? No, this is the omohyoid, and this is the tendon
The
of
tendons
it.
are.
Tendon of it. Okay, and then what about the next muscles? Here, now we turn this back. This is the hyoid bone, and if you we look at the muscles from layers to layers. So the first layer, this will be the mylohyoid. because here this was the mylohyoid, then comes the geniohyoid, and then the genioglossus. So mylohyoid, I have to get that.
I get you.
Try to